Good afternoon. My name is Ben Rogers, and I am chair of the Linn County Board of Supervisors. We had our last COVID-19 press conference in May, and unfortunately, we are back to report some disheartening news about the virus spread in our community, particularly over the last 14 days in our community and in surrounding communities and cities. I would like to start this press conference remembering those who lost the fight with COVID-19. More than 80 Linn County residents have died. Many of these people died alone, on a ventilator, unable to be surrounded by their loved ones. More than 1,200 of our Linn County residents have tested positive for COVID, with many losing their jobs, their livelihoods upended, their faith in the future shaken, our way of life changed, and children and students unable to complete the school year, missing prom, graduation, final seasons of sports, and many other milestones that many of us can remember fondly from our youth. Now, it's become typical for an elected official to talk about this in unprecedented terms, but I think that term has lost its punching power. In the early stages, this was unprecedented. We didn't know how to live with or adapt to COVID, but now we know, and we can no longer plead ignorance to or ignore the science of what this virus is, how it spreads, the damage it can do to our economy, to our health, to our loved ones, and to our children's education. What is being asked of you today is the most minimal and the least invasive of sacrifices: to wear a mask or a face shield when you are in public, at work, or in close proximity to someone else. By doing this and practicing social distancing, we can begin to slow the spread down, but this will take all of us, collectively, unified, towards a common goal of reducing spread. This doesn't work if only some people take this advice seriously. It is achieved if we all take this seriously. Your government is working hard in both assessing, planning, responding, and innovating. The health and safety of our residents is our #1 priority. Now, we need you to make the following public health guidance your #1 priority. It will keep you and your family and your friends safe. Please wear a mask. In the United States, we average around 40,000 deaths from traffic accidents each year, and for that reason, we all wear seatbelts. In just a few months, we have had 127,000 deaths nationwide from COVID-19. Think of this as a seatbelt for your respiratory system and the prevention of COVID spread. And as you'll see today, we are all wearing masks. Masks are a demonstration that you care about the health, safety, and well-being of the people around you. Not wearing a mask is a demonstration that you care little about the health, safety, and well-being of those around you, because wearing a mask is one of the most effective ways of reducing spread. We also need each other. Our numbers are climbing, so we must be diligent and increase our efforts to meet the rising numbers. I really do thank you all for your efforts to date, and imagine how much worse this could have been without all of your sacrifices. Even though we have all worked hard, COVID is still here, and we need to depend on each other to make sure the spread is minimized until we have a vaccine. Keeping the economy open. Please follow the guidance you hear today. It is our best chance to keep people healthy, prevent our hospitals from being overrun, and keeping the economy open in Linn County. We all want to get back to normal, but for now, normal is following the guidance of our health professionals. I am sensitive and saddened to the fact that many in our community have experienced tremendous financial and emotional pressures from losing a job, having their hours reduced, and having their children at home while all trying to stay afloat. Even under the best of circumstances, having our children home during the workday is stressful and can lead to additional mental health issues. With the school year quickly approaching, it may very well be the case that in-person schooling is not the safest option. We may experience greater pressure on our workforce to have to figure out how to let parents work from home if they have a job, and school their children at the same time. COVID does not care about the economy. It is not a personality that you can tune out because you don't agree with its politics. It is a virus. But if you care about the economy, your children's ability to go to school, your ability to work or find employment, and the health, safety, and well-being of others, then you need to take these recommendations very seriously. This weekend, we are celebrating Independence Day. Our freedom and independence is something that is fought for, not given to. If we want to be free from COVID, we cannot be passive passengers. We all have to be leaders who take this seriously and to be role models for our family, our friends, our places of work and worship by setting the standard for what freedom from COVID looks like. Wearing a mask, practicing social distancing, and not gathering in large groups. So as we enter into this holiday weekend and for the many days ahead, please be safe and take care of each other.
Good afternoon. Dr. Tony Myers. I'm the Vice President of Medical Affairs at Mercy Medical Center. It's been a few months, or certainly quite a few weeks. It seems like it's been a lifetime. I'm going to start by giving an update of where the hospital is. And Dr. Arnold at Unity Point and I still communicate every day. The hospitals are in similar situations. Essentially, you may remember when we had our worst surge towards the end of April, we were averaging between 8 and 14 critically ill patients with COVID a day in the intensive care unit at Mercy. That number decreased. That lasted for the better part of a month. That number then decreased to about half that many. And then the last time I was here, we were averaging closer to 4 a day. And over the last couple of weeks, it's gone down to 2. So the hospitals right now are both in similar situations as far as hospitalized patients, and we certainly have a lot of capacity. In fact, both hospitals decreased some of their ICU capacity that they had built because we basically overshot by about 3 times as much as we needed, which was a good thing. While we decreased capacity, we still have double of what we would normally have. That would easily take care of a similar surge that we saw in April. And of course, we can surge back up to more if we need to. So the community should be reassured by that. Also, our understanding of COVID from a medical standpoint has evolved over the last couple of months. Providers across the country and locally have found slight different ways to take care of COVID patients. It's a very unusual disease. You have pulmonologists, lung experts that have worked with lung diseases for decades, and COVID is different. It's really severe, but there are slightly different ways and techniques that they're using to care for these patients, and part of that is actually trying to use every type of support and positioning that you can to avoid putting somebody on a ventilator. Once you get on a ventilator, it's extraordinarily difficult to get off. Obviously, we still need to put some people on ventilators, but there's other ways to support them, and that's been a shift in treatment for the better. Also, both hospitals have access to the newer, proven, safe, beneficial medications, including remdesivir and convalescent plasma. Both hospitals have used these medications. The plasma is where somebody has had the disease and has recovered, developed antibodies, and then we can harvest those antibodies and give them to a critically ill patient. Again, these things help, but at the end of the day, this is still a battle that has to be borne by the patient. They need to fight this virus off on their own, and we are primarily put in a position of supporting them the best we can. The recent increase in cases, and it's important to know, I think Supervisor Rogers did a really good of explaining what we are concerned with and what we need to do, and I'll at the end, of course, say the same thing over, but it's typically there is a lag. Even though the hospitals are in a really good position right now, once there's a surge in the community, and we've seen this across the country, there's 2 to 4 weeks before we start to see an impact on the hospitalizations. What we're seeing now are younger people, but eventually the people that are at most risk, the older people and people with medical conditions, will get exposed if the community continues to surge. Hospitals continue to screen all patients, visitors, and staff at entry for symptoms and fevers. And we are all required to wear masks, and visitors are required to wear masks, and limit movement throughout the hospital. Because of these safety precautions and the current incidents in the community and how the hospitals are doing right now, we've been able to loosen the visitor restrictions, which have been incredibly tight and I know difficult for everybody. That said, there's still restrictions, and if the incidence in the community increases, we may have to tighten visitor restrictions again. But because of all those screening things that are in place and the masking in the hospital, really, hospitals remain one of the safest places to be. And they continue to provide emergent and non-emergent surgeries and procedures. This is a very important point. There was a tendency, especially during the surge, for people to avoid going to the hospital at all costs. This included not ignoring, but not going to the hospital when you should for symptoms that suggested something emergent, like a heart attack or a stroke. This happened across the country. This happened right here in Cedar Rapids. There was loss of life because of it. And I want to strongly impress on people that if you're having concerning symptoms, please go to the hospital, go to the emergency room. If you think you're having a heart attack or you think you're having a stroke, the hospitals are a safe place to be. We're one of the safest places to be right now because of what we're doing. And then the last point, again, is similar to what Supervisor Rogers was saying. At this point, one of the things that's incredibly clear is that what we have done, or what everybody has been doing to different extents across the world with hand washing and social distancing and masking works. It's not a question of whether it works or not. It works. Nobody wants to go back to a place where we are stuck at home and businesses have to close. Please, please avoid large gatherings, wash your hands, and wear masks when in public if you can't maintain that separation. Thank you.
Good afternoon. My name is Heather Metter, and I am the supervisor for the Clinical Services Branch at Linn County Public Health. I am here today to provide an update on COVID-19, as there has been an increase in the reported number of cases in previous weeks. The number of average cases per week have increased from 35 cases the week of June 7th to 101 cases the week of June 21st. This is a 191% increase in total cases reported per week. We are concerned about the increase in average cases reported, especially as we near the July 4th holiday, where traditionally people gather to celebrate with family and friends. COVID-19 is still here, and it's still spreading within our community. The increase in cases that have been reported are linked to community spread, which means the person cannot identify where exposure occurred. We are seeing an increase in cases among people aged 18 to 25, and due to the increase in reported cases and community spread, Linn County Public Health recommends all of our residents to take measures to maintain a physical distance of 6 feet between yourself and others. Wear a cloth facial covering when physical distancing is not possible, and practice the 3 C's, which are to clean your hands often with soap and water or hand sanitizer, cover your coughs and sneezes, and contain your germs at home when you were sick. No matter how mild the illness, you should stay home when ill. These safety measures are critical to protecting our community. We know many young adults are resuming activities that lead to community spread of COVID-19, such as visiting crowded bars, attending parties, backyard gatherings, and planning pub crawls and other large downtown events. Previously, when social gatherings were more restricted, most Linn County cases were among older adults. Since reopening, there is a false sense of security that life can go back to normal. However, we are still in a pandemic, and life is not back to the way it was before COVID-19. Since reopening, cases have increased partially because young adults are gathering and not following social distancing or wearing a cloth facial covering. We are also aware of gatherings and events such as prom, graduation activities among teens. Our concern is that we will begin to see an increase in virus activity among those aged 15 to 19. While we have not seen COVID-19 causing severe illness or hospitalizations among young adults or teens, we know that there are many people that are unaware of underlying chronic health conditions and are at risk for developing severe illness that may result in hospitalization or death. Additionally, the risk of spreading this virus to older loved ones or those with underlying health conditions is still a threat. Additionally, we have also noticed that people that test positive for COVID-19 need a reminder of what they should do to prevent spreading the virus to others. The recommendations for isolation for those that test positive or those that are a contact to someone that tests positive have not changed. If you have tested positive for COVID-19, you must self-isolate until you've had no fever for at least 72 hours, which is a full 3 days of no fever without the use of fever-reducing medications, and other symptoms have improved, and at least 10 days have passed since symptoms first appeared. If you are a contact to a positive case, you should self-isolate for 14 days, regardless of whether you have a negative test result prior to completing the 14 days of self-isolation. The incubation period for COVID-19 is 14 days. Testing is a point-in-time test. Therefore, having a negative test one day does not mean that you won't have a positive test in a day or two. Therefore, if you are a contact to someone who has tested positive for COVID-19, you need to complete the full 14 days of isolation and monitor for signs of illness. We do encourage all contacts to individuals positive for COVID-19 to receive testing, so that if you are also positive, we can follow up with those that you may have unknowingly exposed. Testing does not change the need for contacts to self-isolate for 14 days. If you have symptoms of COVID-19, we encourage you to contact your healthcare provider for testing. Your healthcare provider can determine if testing is appropriate. Recovery guidance for those that test positive changed to 28 days per Governor Reynolds. This is linked to the classification of cases and does not change the recommendations for individuals that have tested positive for COVID-19. We continue to work with our partners to respond to the COVID-19 pandemic. We are working on guidance for schools that will be opening, and we plan to share this at the end of the week. This marathon has not come to an end. We need to put some of our wants and our desires aside to protect our families and community. Please follow our recommendations to limit the spread of this virus, such as maintaining a physical distance of 6 feet between yourself and others, wearing a cloth facial covering when physical distancing is not possible. These are proven strategies for the prevention of spreading this virus. Thank you.
This is the end of the prepared remarks for today. We do have time for some questions for our media partners on the line. Just indicate to the moderator if you have a question. I understand we do have one for Dr. Myers. Just as a reminder to our media professionals, only the speakers on the schedule are in the room. So if you do have questions for our other COVID response partners, to please direct those to the communications contacts. And then as a reminder to the speakers, please repeat the question before answering. Travis, I believe your question is for Dr. Myers. Would you like to go ahead?
Yes. Hi, Dr. Myers. I was wondering if you think that the hospital would need to, I'm sorry, I got an email. If you think the hospital would need to slow down the rate at which it has been resuming any surgeries to possibly increase bed space for a second wave of increased hospitalizations.
So thanks, Travis. The question really was, if I understood correctly, was do we think that we're going to have to back away from some of the procedures that we're doing, the non-emergent procedures that we're doing in the hospital? That's always a possibility, Travis. We are prepared to do what we need to do. The main reason, honestly, that we needed to do it early on was because of lack of PPE. This was a nationwide shortage, everybody remembers. That's no longer a problem. So since we're not facing that, then the bar to have to stop doing those things would be different. The next step would be if we would need extra staff, that we would need to divert from staff that is working in those areas to take care of other things. I would like to hope that we would never have to do that, but we are certainly prepared to do it if we need to. Any other questions?
We have one from Kate Payne. Kate, go ahead.
Okay. Thank you. So this is for Ms. Metter and or Supervisor Rogers. We're seeing communities across the country mandate the use of masks, whether that's at the local level or the state level. It's our understanding from the state attorney general's office that local don't currently have that legal authority. But I'm curious if you all think local communities should be able to do that, and if the governor should take action to facilitate that.
Thank you very much. The questioner asked if masks can be mandated, and as I think has been alluded in earlier press conferences in COVID, in this COVID response, the state of Iowa actually the governor has to delegate to local cities and municipalities the ability to implement some of those restrictions. So we cannot mandate, and by we I mean Linn County cannot mandate that citizens wear a mask. However, when Linn County opens to the public by appointment only for our buildings, every citizen will be required to wear a mask, and if they don't have one, one will be provided to them. I would encourage all businesses to do similar, that they require their patrons to wear masks, and if their patrons do not have masks, that they provide disposable masks. This is how you reduce the community spread, and as an elected official, someone who has to oversee the health and well-being of both an organization and the citizens you represent, you wish you had every tool at your disposal. There are other states whose cases are declining because they took more extreme measures than the state of Iowa has. There are other countries that took more proactive measures, like New Zealand, that hasn't had a positive case in well over 3 weeks. In fact, they had a full rugby game of 40,000 people. There's ways to do this, and that includes requiring people to wear masks. Unfortunately, we do not have that here in Iowa, and I would wish anyone who does travel out that they do wear a mask or a face shield. It does demonstrate that you care about the people around you and the people that associate with those that you care about, and certainly when you enter into a Linn County building, you will be required to wear a mask, or we will provide a service to you differently if you are unable or unwilling to wear a mask.
Thank you, Supervisor Rogers. Kate, did you have any other questions? Otherwise, we will move to Isabella.
I think I'm good for now. Thank you.
Okay, Isabella, go ahead with your question.
Okay, thank you. My question is for Heather. I was wondering how Linn County Public Health is doing with contact tracing, especially with the increase in cases. I was wondering how many employees does Linn County Public Health have that are focused on contact tracing, and if this is a number you're comfortable with.
Thank you, Isabella. So the question is in regards to contact tracing and if Linn County Public Health has enough contact tracers and if we're comfortable with that. Linn County Public Health is extremely fortunate that we were able to have 2 full-time contact tracers added to our team. These are CDC Foundation employees. So they are now part of our team, and their job is to work on contact tracing and our COVID-19 response. So we are very fortunate to have these 2 additional people. Besides having these 2 additional people, we also have onboarded several contract employees. Many of these are students with the University of Iowa College of Public Health, plus other individuals within our community. So at this time, we have been able to follow up with every single case of COVID-19 within Linn County. At this time, we are very comfortable with the number of contact tracers we've had. We do follow up with all individuals from the time of diagnosis through the time of recovery, and we have been able to stay on top of that. However, we will see what the future brings. We do not have a crystal ball. Once school starts, once colleges are back in session, those numbers could dramatically increase, and then we will need to reassess our staff pool. But at this time, we are very comfortable, and we are able to meet the needs of our community. Any other questions, Isabella?
No, that answered it. Thank you,
great.
Heather.
Thank you.
Okay, I'm not seeing any other requests for questions come through our virtual meeting platform, so I will open it up to anyone else that's on the phone that has a question for our speakers. All right, hearing none, this will conclude our press conference for today. Thank you for joining us for these important updates regarding COVID-19. We will hold press conferences as needed, but do not have another one scheduled. We do encourage everyone to visit linncounty.org/COVID-19 to receive information and also access through our social media channels. Traditionally, in previous press conferences, I provided Linn County metrics to date. So in honor of tradition, I'll do that again. Linn County currently has 1,233 cases, 1,034 individuals have recovered, and there have been 82 deaths of Linn County residents. As a final reminder, please practice physical distancing by maintaining 6 feet between you and another person, and wear a cloth face covering. Stay home when you're sick, and wash your hands often and cover your coughs. Thank you.